I think one of the most important things is that you're including caregivers with patients in being thoughtful on what to consider during the drug process. Caregivers are not there just for adherence, but they really have a different perspective about information and the quality of life that a patient's going through. Firsthand, my husband and I were both diagnosed with cancer concurrently, so I was his caregiver while I was also a patient. And there were many times where we were in doctors' offices and his perspective of what a symptom was, a side effect, and the ripple into our life was very different than what I was seeing.
My name is Daniel Cramer, and I am not only an Associate Director of Congressional Affairs at the ALS Association, but also a caregiver and a son of somebody who passed away due to ALS. We don't know what to address in somebody's life, in a patient's life, unless we ask them. We know that ALS causes the death of motor neurons. We know that that leads to the inability to walk, to the inability to talk, to swallow food, and to eventually breathe. What we don't get, if we're only looking at things in a lab setting, is the side effects and the ripple effects in people's life that causes. My mother struggled with mental health issues. She had to be on anti-anxieties, antidepressants, things of that nature. She was very open about it.
Information is power. So at any stage when you're making a decision about what you want to participate in for yourself, whether it's a medicine that you're choosing to take, if there's choices, or understanding that you want to opt in or opt out of something, knowing all the implications of that medicine, not just to your body physically, but also cognitively and in terms of your mental health and your daily activities and what matters to you.
I think one of the key things here is that when we look at drug development, we're working towards that cure feverishly. We also need to understand that extending life, making it so ALS is a livable disease, can have more people engaged, can have more people in the clinical setting, can have more research done so we can get to that endpoint faster. A drug that would extend my mom's life 6 months, to me, that's priceless because it would have made it so we had a last Thanksgiving. It might have made it so she could have imparted a few more words of wisdom on me before she left us.
Everyone's goals as a patient and as a caregiver are different, and understanding someone's care goals is really critical to the decision process. Utilize groups that already exist, have them participate from the first step of a process, have them at the table, not to validate something. So it's not, here's what we're proposing, do you support this? It's having a partnership. What do you think? How do you think about it? Tell me more about that. Have opportunities for follow-up later.
I lost my mom and I'm still here advocating for people because I really care about this community. I think it's really important though that we understand where frustrations exist for people living with ALS and other patient communities that deal with this too. They feel like a lot of people in suits, unfortunately I'm wearing a suit today, but they feel like a lot of people in suits are making the decisions for them. And that's not right. I think more groups need to take that approach where you say, okay, we're not in the room, to quote Hamilton, we're not in the room where it happens, but let's powerhouse our way into it. Let's drop a package of experiences that you cannot ignore on your desk so you can start to see the holistic view of what we experience, of what we need, and why this is so important and so time sensitive.